Okay, we're recording now.
Okay, so I'm gonna click on the. Oh, it's not letting me. Oh, here it goes. Just kidding. Okay, so the title of mine is lumbar intervertebral disc degeneration in elite competitive swimmers, and it's a case control study. So basically, hold on. It kind of starts with like it talks like about like any sport with extreme upper and lower body movement is highly likely to see like lower back pain, and so they're trying to prove if that correlates to degenerative disc disease. um, so in this one we're specifically like focusing on competitive swimming activities. Does it accelerate lumbar disc degeneration? And it's just kind of focusing on those elite swimmers. um, at some point they all have lower back pain, but it doesn't really prove if it is degenerative disc eventually. But hold on, let me re-explain this. So at some point they all have lower back pain, whether it be like some pain, constant pain, or pain that prevents them from doing stuff, especially like daily activities and like working out. So some of that pain is degenerative disc, and some of it's other stuff, and that's kind of what they're talking about. Does it progress into degenerative disc, or is it just a broad thing? And can they prove that? Well, they found out when doing this that degenerative disc is mostly in the L5 to S1 on swimmers. And the case study took a group of 56 elite swimmers and 38 student swimmers, so like kind of like high school, like a club. And then they did tests on both of them, and they were given a questionnaire first about the distance of swimming they do, any history of lower back pain they've had, and their lower back pain causes like issues with training or daily activity, and then the duration of competitive swimming, and then so on. And then they examined the lower lumbar spine, and they did it like two different places. The student swimmers did it at a university, and the competitive ones did it through it talks about it later. Um, and then they had two doctors at random take all the images and assess them. And they didn't tell them like this was a competitive or this wasn't. They just had them take all of them and did it and like assess it. And then later they went back and reassessed again 200 more images to see if they still got the same results, and they did. And then the summary of the intervention is that they used a T2 weighted fast spin echo MR for the images. I've never seen one of those machines. It sounds really fancy. At the Japan Institute of Sports Science where they did it. And then the students, they did it at a university they did a mid-sagittal image, intervertebral disc from L1 to 2, and then to L5 to S1 were classified into 5 grades. So that's how they decided to classify if it was degenerative or not. And so the grades were 3, 4, and 5 were considered degenerative. And then they had those 2 orthopedic surgeons who were unaware of it, like I said earlier, and they had them assessed. And then again, they would 200 more discs and chosen at random just to make sure on the reliability. And then it ended up being high. It was 81. And then they also examined the reliability was 89, and then they repeated it to make sure, and the results were 81. So it stayed pretty much the same. So they knew that the test was pretty right. There wasn't much room for error on it. And then they did the Fisher's exact probability test and an unpaired test, and then the 0.05 or less was considered significant. So they like comparative outcome of all of this. Basically, there was no noted difference in gender between the two groups. So females and males weren't really different on having the lower back pain. So 43 participants in the high low group and 38 and participants in the lower group had history of lower back pain, which is a high majority of everyone that they had done the test on. And then 29 participants in the high load group and 14 in the low experienced severe low back pain that affected their daily activities and training. And then they compared the average, and of course the high load was higher, and then they compared the amount of swimming that they do per week and overall in training, and of course high load was higher. And then the relationship between degenerative disc and low back pain was examined for male and female swimmers, and no correlation was found between low back pain history and disc degeneration, but 14 female swimmers were manifesting the disc degeneration, had history of severe low back pain, and then non-degenerative disc had a history of severe low back pain. So there was no correlation between the amount of pain that they had, which makes sense. And then the high load group, 21 were freestyle swimmers because they started to compare like what kind of swimming they did. 14 were backstrokes, 9 were breaststrokes, 11 were butterfly, and 7 were individual medley swimmers. So they were kind of comparing like, does a certain like swimming style make it worse? And there was no high significance, so they're about the same. So they couldn't really like say, oh, this type of swimming makes it degenerative disc happen more. So basically the summary is kind of what I talked about already. So my opinion on it was I was shocked. At first I was shocked that like they couldn't correlate lower back with degenerative disc, but lower back is such a broad term. So there's no way to be like, oh, like it's directly this. And then I was kind of shocked that female and male, huh?
There's so many issues that can cause low back pain. It's hard to make a correlation between one and the other.
See, and that's I was like, oh, that makes sense. Like, because you can't really just, that's too broad.
I mean, we see it every day in the training room. If you think about it, a lot of times we'll use like muscle energy to fix a hip malalignment that's causing back pain, or we have strained muscles in the back that can cause back pain, or we have a degenerative disc issue, or something like scoliosis or something like that can cause low back pain. There's just so many different things that can cause it that you're not going to get a correlation between. Well, I have pain, so this is the problem in any group. I don't think.
Well, yeah, that's true. And then like if like the hamstrings hurt, like that can cause pain in the back. And so that was like what I was like, oh, okay, that kind of makes sense. And then I was shocked when they brought out volleyball players because they did like kind of use volleyball players and gymnasts to kind of compare, because you wouldn't really think a volleyball player at first would have like degenerative disc with like in this kind of sense. And then I thought about it and I was like, oh, that's interesting. And then that's why they use swimmers, because not a lot of people would have thought that they would have degenerative disc or low back pain. But it made sense to me because of the amount they use their hips when swimming and their whole body.
Yeah.
So like, I was like, okay, makes sense.
The non aspect of it though, and the non-weight bearing aspect of it makes it kind of shocking that they would have a disc issue. I would think more muscular, but I guess with the amount of the flexion that you're having in the spine for any stroke, with your hips moving back and forth, you're going to have some low back disc issues.
That's true. I didn't think about like you said, it would be more muscle because it isn't weight bearing. It's more of just like their body. That's interesting. I didn't think about that. But it was mostly found in L5 to S1 was the most common area for the degenerative disc, which makes sense because that's where all the pressure is. That's why I was like, okay, that made more sense. And then I was shocked that gender wasn't broader because females usually have more hip issues and issues in that area than males. So that's why I was like, that's interesting. The questions that I had was what information do they need to be able to compare low back pain with degenerative disc, which I guess would be just more, they need to make it more generalized and not so broad. And then is there a possibility of degenerative disc in other places on competitive swimmers due to do a different study? And is there a machine that they could use to help correlate more? And then is there certain injuries they can look into to give progression on degenerative disc, like in swimmers? And then I think this case study, like, I think it's just like something good to know because a lot of people don't think about swimmers, and like if you have, even though it's not really high in high schoolers, it's still good to have just to like I mean, as a high school trainer, you really don't see the swimming kids a lot, so if they come in with back pain, it's good to just kind of assess those areas and to kind of keep that in the back of your head. And then it's also good for like volleyball players and gymnasts. I think like Olympic athletes like that, that's something to more look at and do more case studies and reports on them. And then as an athletic trainer, it's like a good thing to keep in mind to check. And I also think it could bring more like testing and leading to like other athletes like dancers and figure skaters and stuff like that. Because if you can think swimmers, you can think figure skaters when they're jumping and falling, like not falling, but when they land, if it puts pressure on those discs, then their correlation with back pain. And just kind of knowing to screen those areas more. And I think that eventually they could have more cases to show low back pain and degenerative disc do correlate, but I think they need to make it more specific and not so generalized.
Yeah, because like I said earlier, in a high school setting, I would never think, like if you told me to tell you what injuries I would think in a swimmer, degenerative disc would have never been one that I would have said. So it's interesting that is a problem, and it looks like it's a fairly common issue for.
Yeah, it's there's a high number of the athletes, which like I don't know, it's just like one of those like you said, like with swimmers, like you just don't think about those things because they're not athletes that like we specifically see a lot of
And because
that we get to like take care of.
it's a non-weight bearing issue that's affecting a shock absorbing, a disc is for shock absorption. You don't really think of much shock going on in the water because the water kind of disperses all of that. But with, you know, the amount of just straight repetitive motion, even if it's a low amounts of, whether you want to call it shock or trauma with each stroke, that eventually is going to build up to what, your athletes that you would more commonly think of a disc issue with.
Yeah. Like because you would think weightlifters, like you said, because it puts more trauma on those discs because it's weight bearing. But then like with swimmers and like figure skaters and probably dance, you don't think about it because it's more of like, I mean, I guess with dance and ice skating you might because it's more of the impact, but yeah, swimmers definitely not. And then I would have thought that there would have been a bigger correlation or a bigger gap between, not correlation, but like a bigger gap between different like swim styles. But it was interesting to see there wasn't a huge gap.
The correlation, or not the correlation, the comparison that I would be interested to see would be your, like, I guess they still call them sprints in swimming, like your short or swims, like your 50-meter racers versus your longer racers. I would want to see if there was a difference there. Um, so.
Well, I'm also interested, like, it didn't really, like, put the other things into perspective, like, how much do they, like, lift weights? Like, what are they doing outside of swimming? Like, are they running? Stuff like that I thought was interesting because I think it can also differ on what are they doing outside of swimming that could also cause, like, are those people that are with having the degenerative disc, are they also weightlifting on top of this that's causing it to speed it up versus people that aren't doing it as much.
Yeah, and like as someone who's participated in a survey or like a study, I was in Rachel's, and with me and Hayden, it's one of those deals like you can't control what they do outside of your study so much. And a lot of times we couldn't even control it. Like we have daily lives that we live, and so whenever you're looking at research, you have to understand that we don't live in an ideal world. So yes, all you would like to see ideal world research, it's not realistic. Even if we had it, like it doesn't correlate to what actually happens in real life. So I think too often we shoot for real world or like ideal world stuff, whenever really we should understand that in the real world people are going to do things differently, and that's just how it is.
Yeah, that's true. You're right there.
Well, I thought you did good there. I think that a lot of this, like these projects, are to make us see special populations that we wouldn't have thought about, and make us think about injuries that we wouldn't have thought about, and then make us go and do some research on our own. And I think that it definitely kind of made me think about what injuries would be common in swimming. Because I mean, obviously, you hear about the concussions from running into the wall with swimming. You think of, yeah, I know, who would have thought? And then you think of, like, shoulder overuse injuries, potentially some hip overuse injuries. But I would have never thought back issues would have been a problem in swimming. So it's good.
Yeah, I think that's definitely why it drew like because normally I would have probably chosen something about football or like baseball sports that interest me more. But then I saw this and I was like, that's really interesting. Like we don't work with swimmers a lot. We don't talk about swimmers a lot. And the fact that like you said, like I would have never thought of like this degeneration. Like I would have thought, yeah, back pain because of muscles and stuff. But then the disc, I was like, what? So
Yeah.
yeah, I think that's why I like this because it draws you to other things that you wouldn't have ever thought about.
Well, good. Okay. I guess stop sharing your screen, and I will start sharing mine. Um,
So that like big bird noise was a huge hawk landing on like a tree over there, and I was like, "Holy crap!"
you don't have any little puppies around, do you?
I don't know if Heidi counts as little.
Uh,
I
so mine was
fuck off.
a straight case report, about, which I have it somewhere over here, but it, it was short. It was like 2 pages. That was 3 pages. And it was just about one specific situation. I kind of have it all summarized throughout this. So I don't really. If you want, I'll send you the link to it later if you're interested in it. But um, basically, what it was is a 21-year-old. He's a pole vaulter. He goes up for a pole vault and he missed it, and kind of, I think the way that it described it, kind of missed the pad, and rolled his ankle. Let me see. It was an inversion. Yeah. Or wait, no, it says it on here. Yeah, an inversion ankle sprain basically is what they initially thought. But was, whenever you're pole vaulting and you come down from that height, it's going to be a pretty traumatic injury. So they thought but they thought it was just a, possibly a grade 3 inversion ankle sprain, and so they sent him initially. The the athletic trainer that was on site, which was not his home athletic trainer, he was traveling, sent him to have X-rays, and the X-rays came back negative. They put him on crutches and an air splint, and so that was on a Friday, and then Monday they started rehab with him. Um, and so initially, the rehab started out with just a range of motion exercises, uh, and the initial the initial injury assessment was a third degree of the posterior talofibular. And then so they started rehab for that. So they focused on range of motion because he had reduced range of motion, and they wanted to reduce the edema, and so they kind of went with that for the first few days, and then started working on some strengthening. They went through 2 months basically of regular rehab, which they said regular ankle rehab, which kind of frustrated me because I don't know if you have a set ankle rehab, and I don't know if your set ankle rehab is different than my set ankle rehab. Like, I don't know what your regular ankle rehab is, but that's the
Too
wording.
broad.
But yeah, so they went through 2 months of it, and he was still having uh, pain and stiffness, and he started having some mechanical issues, so like popping. kind of behind his fibula, between his fibula and his Achilles. And so eventually, after a little while, they sent him in for a MRI, and the MRI showed uh, some ossification around a free-floating body that was a fractured trigonum or os trigonum that had broken off and now had become free-floating between the talus and the Achilles. So kind of in that little empty space. Here, there's a picture down here that kind of shows you the anatomy that we're looking at here. So you know what? So obviously we have the talus and the calcaneus. It looks like we're looking from the other side here. So like the tibia, and you see the fibula back there behind there. And so a lot of times whenever we have, it says it up here, I think it's excessive plantar flexion, we'll have these two bones pinched together, and what'll happen is this bone will break off the os trigonum, which is a part of the talus. And so whenever it breaks off, it'll become a free floating body back here. But because it's such a small bone, and not really, we don't think of it as a common issue, a lot of times the pain is misperceived because we come in here and we'll take an x-ray, and sometimes that bone will be too small to really pick up that it's fractured on an x-ray. And so we'll say, oh, well, the talus is fine and the calcaneus is fine, and we're not seeing any issues down here in the midfoot. And it'll get missed and diagnosed as a sprained ankle, basically, whatever ligament they decide to sprain at that point, which most likely they do have a sprained ankle. That's not a misdiagnosis. That's just a partial diagnosis. And so with that, it had fallen back into this area right here, and he was having a lot of pain and clicking and that type of issue. So after the MRI, they decided that it was necessary to have surgical intervention. I didn't go into it. They talked about the surgery. I didn't dive into it much because I don't feel like it's necessarily like, yeah, we need to understand what they're doing in the surgery, but we don't have to understand every step of the surgery. It's not our job. We're not surgeons. And so basically, if you wanted to know, he was laying prone with his foot held up, and they cut right behind that same area where he was having pain. They cut right there, went in, took out the free floating body and all the other debris that were associated with it now, because it had started to have ossification in that area. So they cleaned it out, sewed him back up. Do you have a question?
Oh, so he didn't need to have, like, it's not like he didn't need it, like, he could just have it pulled out. He didn't need it, like,
no,
put back together.
No, it from what they said, basically, there's not, and it didn't, that should have been a question that I asked. I didn't ask that question, but I'll add it to it. But are there any attachments at this location?
Because if any, like, anything attached to it, I would wonder if it had to, like, or would it fuse back together? I guess normally it could fuse back together if it was immobile and it wasn't floating as much.
Well, it had removed itself too far in his, which they didn't show on X-ray, which was another thing that kind of frustrated me. But it had fallen back far enough, they said, that it couldn't reattach. And so
okay.
Which I guess in that instance, if there is anything that attaches there, but it said that it wasn't an avulsion. So but that's something that I need to look up, is if there's an attachment there. So good question. But getting back to it, he had the surgery and it was successful, and then his return time was, let me find it. It was,
is it,
he I didn't type it in here. It was like within 2 weeks post surgery, he was back to activity, which I thought
I
was
guess it's not like a necessity area.
yeah. And he had already done so much prehab. Like I said, he had done 2 months focusing on reducing edema and strength and stuff. So basically, he did 2 weeks following the MRI, went into surgery. He was placed in a boot. Uh, he went. They said basic range of motion, dorsal and plantar flexion, basically, and strengthening exercises over like a week, and was back.
Hmm.
So it was interesting that it was that quick of a return, and it was also interesting that they didn't give any in depth on what they did for the rehab. But I mean, range of motion, he's doing dorsiflexion flexion and strengthening. He's doing it with a band, most likely.
That would be interesting to compare this study with another study of someone that didn't do prehab to see if like they would be out
Yeah.
as soon.
Well, and the prehab wasn't intentionally prehab. It was we're trying to rehab an injury that was there, but we're ignoring the underlying real issue, the bigger issue here. So, but it was interesting that it worked basically as a prehab.
Hmm.
So I and they said that he was able to finish out the season, so that was good. Um, but summary of comparative outcomes, it kind of said it was talking about like what would have happened if the issue wouldn't have been caught, and eventually he would be able to function. I mean, he was able to function a little bit then, but he would have had chronic pain and chronic, just like a torn labrum. He would have had chronic mechanical issues where he has popping and that type of thing. And so it would have become a chronic issue that he would have been able to work through, but wouldn't have been able to function as highly as he had before. Basically, was the comparative outcome that they had. So they didn't compare it to another treatment outcome. But like I said, I would be like you said, I would be interested to see what the comparison is between somebody who didn't do anything for that first amount of time and then went on. My biggest thing, the reason that I picked this was I wanted to kind of delve into more of what an os trigonal fracture was and what the surgery associated with it was and kind of just understanding that injury more, because we've talked about it a couple of times in clinicals and stuff, but I didn't really necessarily understand what it was. So now I got it a little better.
I think it's also helpful to like because that I mean I've dealt with so many ankles and done so many ankle rehabs. It's something to like now have like good in the back of my head, like if this isn't really working or I still have something like I'm still suspecting something, I can kind of suspect that. And it's interesting to hear like pole vaulting is another like athlete and sport that we don't really focus on a lot. Like it's not really like it is common in high schoolers and you do see it with them, but they're not the big track athlete that you see a lot of.
Yeah. Yeah. So, and I mean, again, kind of like we talked about in yours, this isn't necessarily the injury that you would expect to see you would expect to see, neck, back injuries, potentially shoulder injuries from, the pull on the pole and that type of thing. But you
Yeah.
don't think about necessarily the landing wrong on your ankle because they're not supposed to land on their feet ever. But when things go
Yeah,
wrong,
because they're supposed to land kind of on their butt.
yeah, butt, back, that area.
Yeah.
So summary of discussion, it focused primarily on why it's commonly misdiagnosed, and that it's misdiagnosed for extended periods of time because we get an x-ray and it doesn't show a fracture. So we just assume that there's no fracture off of that whenever, I mean, x-rays are great and everything, but things can be misread all the time. So I think that we get afraid of resending, athletes or patients to the doctor whenever we think that an X-ray missed something. Whenever a lot of times your intuition on that is better than what the X-ray actually is. Um,
Yeah.
it also discussed the common MOI, which was plantar flexion. And so yeah, it didn't, which I need to look up, and maybe we'll discuss it whenever we do our next one over uh, the self notes that we're writing for our videos
Hmm.
with Miss Nelson. You know what I'm talking about?
Yeah. I know what you're talking about.
Yeah. I'll look at special tests that might could help with this. I don't know if there is one that's associated with it, but if there is, it'd be a good one to have in your toolbox, for later on.
Hey, you can invent that and name it after yourself.
Huh? What'd you say?
I said you can invent something and name it after yourself.
Oh yeah, maybe. I doubt it. I would think just basically plantar. Anything where you go into plantar flexion is gonna irritate that area.
Yeah.
So it would be something associated with that, but I don't know if there's actually one out there. Um, so yeah, that was my first question. What type of test? What type of rehab is appropriate for this injury? I would think that it would be, you know, like I said earlier, there's no general ankle rehab, but your range of motion, your strengthening, your balance, your working on proprioception, and and then later on going into your jumps and plyometric type things. And then let's see. And then is there anything that can be seen as a warning sign for this? Is it an issue where if our calves are not active enough, or if we don't have enough to slow down plantar flexion, is that something that can be used as a prehab to prevent an injury like this? And so I don't know. And then, like you said earlier, that we added, are there any or that's the wrong bear? Are there any attachments at this location? Um, And then as far as how to apply this, it's an injury in the ankle, and we see I don't know how many ankle injuries. It seems like about 55 a day, but it's it's something that we need to be able to really be confident in the ankle in general because it's one of the most commonly injured portions of the body. So that's kind of what my
Yeah.
how could we apply it focuses around. And we also need to realize that one X-ray doesn't necessarily rule out a fracture, especially early on. Things can be missed depending on the view of the X-ray.
Well, and
Yeah.
you're right. It's something good to like keep in your toolbox. Like a good thing to like keep in mind. Like, oh, like
Yeah.
could it be that?
Like, are we going to see an ostrigonum fracture every day? No, and we're not
No,
going to see it as
but
common as we would see a lot of other ankle issues. But we can't go, oh well, we're hardly ever going to see that, so it's not that important that we recognize it. No, we need to recognize it whenever it's there and be able to help with it.
I agree. I think this is definitely another interesting one.
Well, did you have any questions for me?
Mm, no, I don't think so. I think my only one I was interested about was like if the attachment and then like a prehab kind of thing.
Yeah.
Like
Well,
if they compared one that wasn't prehab. But it was definitely interesting to see that like that little bone, if it detached, how much
look and
pain and
see
stuff
if
it
I
could
can find
cause
if
to
there's an
leave something
attachment.
else. Hmm.
I'm gonna Google real quick if there's an attachment.
Yeah.
Oh, well, we should have definitely known that one. It's an
Cool.
attachment point for the posterior talofibular.
Hmm. Oh yeah, we should have known that.
Yeah. Hopefully nobody's watching this part of
Interesting.
the video and they don't see that.
Now that leads to more questions of like, what did they do when they were doing the surgery for that?
Yeah, I'm sure they just attach it
Interesting.
to you know back to the talus where the osteogram was.
I don't want to ask you more questions on that because I'm gonna sound dumb.
You're good. All right. Well, here we can talk about setting up a time for the other. I'm gonna stop the recording right now, though.
Yeah, stop the recording.